All right, so we are live now. Welcome everyone to our COVID-19 virtual town hall for the Lamorinda area. Now I'd like to introduce our host and moderator, Assemblymember Rebecca Bauer-Kahan.
Thank you so much, Katie. Hi, everyone, and welcome. Thanks so much for joining us for this virtual town hall for Lamorinda residents. Before we get started, I just want to take a moment to thank all of you, our community. I know that the last few weeks of social distancing have not been easy, and they have brought their own set of challenges. But I'm proud and grateful for our community for staying committed to staying home and flattening the curve and giving our healthcare workers a fighting chance at getting through this and making sure we all make it through safely. We will get through this. This is temporary, and we'll do it together as a community. And this community has banded together in amazing ways. If you're following my social media, you'll see our everyday heroes that we're celebrating, and they are all over our community. So thank you. I also want to extend gratitude to our frontline workers who continue to go to work to make sure our community is prepared and our essential needs are met. And we have two of those workers joining us today. So thank you, Chief King, and to the doctor from the county who have been working every day to keep us safe. Senator Glazer is also here on the line, my partner in the legislature, and both he and I are here to support you today and every day. You can reach out to either of us at our offices via email or phone, check out our websites. I also urge you to check out the other town halls that both he and I have been hosting. You can get mine on all my social media sites, and Senator Glazer's, the ones he's been hosting, are found on his website. There's a lot of great information out there, and we're trying to make sure you have the best and most accurate information. If you haven't gotten a chance to send us your questions, and you have questions during this town hall, they come up at any point. If you're on the Zoom and watching the video, you can use the Q&A portion, and we'll get to those questions. Or if you're listening, you can email them to me at assemblymember.bauer-kahan@assembly.ca.gov, and that should be an email you received as well. We'll try to get to as many of those questions as possible. Often we can't get to all of them, but we will be in touch to make sure you have the information you need. So I want to introduce the wonderful guests we have here with us to give us the best and most local information for our Lamorinda guests. Again, Senator Glazer is here to answer questions and help provide information on the state level. We have with us also, and thank you so much for joining us, Chanel Scales-Preston, who is the district director for our wonderful local congressman, Congressman DeSaunier, to provide us with a federal update. We have Dr. Rohan Radhakrishna with the Contra Costa Health Services, who's going to talk about our efforts to flatten the curve here in the county. We have Jay Lifson from the Lafayette Chamber of Commerce, who's going to talk about our Lafayette community and what our local businesses are doing and how we can support them. We have Chief King, the Chief of Police from Moraga, who will share information about the town of Moraga and what they're doing to help. We have Mayor G from the town of Orinda. Welcome, Mayor, who will be giving an update from the city of Orinda and their response on COVID-19. We also have Lynn Mackey, the Superintendent of Schools for Contra Costa County, to give an update on the County of Opposite Education and what's happening in our schools. I know that's top of mind for me and many school parents out there, so she's here to help as well. So again, if you have a question for any of our guests, please feel free to write in at assemblymember.bauer-kahan@assembly.ca.gov or use that Q&A function on Zoom. First up, I'm going to invite Chanel Scales-Preston, again, the District Director for Congressman DeSaunier, to give a quick update from the Congressman's office. A lot of the efforts that are happening right now are both federal and state, so we wanted to make sure you had the information firsthand, what's happening on the federal level. So thanks for joining us, Chanel, and I know you have to get to another meeting, so I want to turn it over to you.
Thank you. We really appreciate you allowing our office to provide an opportunity from the Congressman's office, just giving information about the federal response to COVID-19. Congress has now passed 3 relief packages, as many of you know, to provide support to our frontline workers, small businesses, and people who live and have begun to be affected. In the first several packages, we worked to make sure testing is free for all Americans, expanding our Food Air program, and strengthening our families' Medical Leave Act for workers. The most recent package, known as the CARES Act, goes a step farther to help Americans and the economy. Some provisions include rebates for individuals and married couples, small business loans, and grants. increasing unemployment payments by $600 per week, also funding for hospitals. Nearly every day, additional federal programs are being developed to provide assistance to American families. For example, the tax deadline has been extended and the federal educational groups are putting out content to help students learning from home. The work in Congress is not done. An interim package is now in the works to provide additional relief to our small businesses, and more is being planned to ensure Americans are receiving the support they need and deserve. During this time, our office continues to remain committed to our constituents and providing assistance to the community. In addition to the resources we have provided, we also have resources available on our website as well. We continue to help Americans get the information they need and the funds that they deserve and to get unemployment benefits. We are also navigating the new ever-changing landscape of small business loans. As always, our casework team stands ready to assist however we can. Please feel free to contact our office at 925-933-2660. We're happy to help out however is possible. Thank you.
Thank you so much, Chanel. And I know your office has won awards for your casework. So,
yes,
I know you're there helping our constituents. So thank you for that. And all of our best wishes to the congressman and his family right now.
Thank you.
Sure. So now I'm going to turn it over to Dr. Rohan Radhakrishna. He is the Deputy Health Officer with the Contra Costa Health Services. He's going to discuss our county's health response. First of all, I want to thank you for all your work at keeping our community safe and working on the front lines right now. There's been so many articles lately about how the Bay Area really took the steps necessary to flatten the curve and do what is right for our community. And I want to thank you and the County Health Department for really leading us in that effort and giving us the best information to make those very hard decisions. Can you talk a little bit about what's happening with the COVID cases in Contra Costa right now? What's the trend? Where are we at? Give some people some information.
Absolutely. I have about a 5-minute update and happy to answer questions later as well. So people should feel grateful to live in the Bay Area. We did take bold, early, and regional action. We're in a better situation than Italy, even than New York. We acknowledge the tremendous sacrifice economically, socially, that people have had to come under, but you have saved lives, and we'll be able to prove that to you soon. We are flattening the curve. That also means delaying the curve and pushing things off a little later, but that gives us critical time to prepare, to get the staffing, the equipment, so we can take care of you if you or your loved ones do get sick and end up in the hospital. Regarding numbers, in the planet Earth, we now have 1.6 million cases with more than 100,000 deaths. In the United States, we have almost 500,000 cases with 18,000 deaths. In California, we have 18,000 cases and almost 500 deaths. And here in Contra Costa County, we have over 500 cases and 9 deaths as of this morning. We take this very seriously, and we are doing mathematical modeling. And what it suggests is, even with the best measures and the public following our advice, up to 2,000 people in our county may die. That could be 15,000 people if people don't follow the orders of shelter in place. So it's really a life or death situation, not just for you, but those who you love, and the aspect of passing on the virus to other people, especially the elderly and vulnerable. So we thank you for your part in saving lives. Now, the data is all available on cchealth.org. You can see it broken down by various groups, and it's now released by cities, so you can see, but we don't want you to have false reassurance if you see that the numbers are a little low in your city. Because of the lack of testing historically, it's a lot more out there than we actually realize. So you should presume it's in every city, it could be in every neighborhood and on every doorknob, and we want people to act as if that's the case, regardless of what the numbers show. The situation is intensifying. While 911 calls and emergency room responses are pretty stable over the past week, the number of hospitalizations for coronavirus has increased a lot, 30% just in the past 48 hours. So right now in our 9 hospitals, we have 42 people hospitalized, confirmed with COVID-19. Half of them are in the ICU or in critical care. And we have almost 24 that are under investigation awaiting their test results. Regarding the timing, we know everyone wants to see in the crystal ball and ask, how long will this go on? Will there be a resurgence? And while the White House and FEMA, the Federal Emergency Management Association, started with 15 days to slow the spread and then changed it to 30 days to slow the spread, we can't promise we're gonna flip a light switch and everything's gonna go back to normal come May. It's going to be more of a dimmer, and we're gonna look at our local data and adjust things with various essential services, government functions, transportation, and infrastructure to play it safe to save lives. Science and math tells us that 2 months of a shelter in place is much more effective than 2 weeks. And aspects of it may be extended, and you'll hear more from us, and I'll clarify a little bit. So we started on March 17th with our initial shelter in place order, and on March 31st, that was extended through May 3rd. We saw the benefits of acting regionally. Viruses cross borders, people cross borders, transit crosses borders. So we needed a regional approach. We couldn't take a city or county by county approach and do things differently. And because of that, our numbers do look better than much of the rest of the country. Modeling suggests that the surge will come. It will be flatter, it will be later, but it will still come towards the end of April or the early part of May. Now, there's still a lot of variables that determine that. We're looking at Google mobility data, cell phone use data, transit data. Within the first week, traffic was down 50%. Within the first 2 weeks, public transit was down 80%. We know that's an impact, but it does help flatten the curve. And based on the public following our recommendations, we can spread things out and decrease cases, hospitalizations, and death. Regarding testing, we do have our public health lab with good capacity. We have enough to test more than 100 people a day. We're able to meet the current demand, and private testing at commercial labs has a turnaround time of about 5 days to get those results when it's less urgent. Some people have heard of serology testing. That's a bloodstream test that proves you've got it and now have immunity, much like we have for measles, mumps, and rubella, or liver viruses like hepatitis. That will probably come out in a few weeks, which will help people who got infected get back to work. First responders, teachers in the future, all of our essential workers. So that'll be a new tool in our toolbox that will come in a couple of weeks. Regarding the shelter-in-place order, what we did was 3 things. First of all, we extended it by several more weeks to May 3rd. Second of all, we clarified aspects of essential services like construction and landscaping. For example, you can do landscaping to have fire prevention or weed abatement, but not for cosmetic reasons. This is serious. We delayed all elective surgeries. If people can wait 6 weeks for their gallbladder or their hernia, we can wait for other cosmetic construction and landscaping projects. But we do understand the economic impact. I want to also speak about religious services, not just this weekend with Semana Santa and Easter, but for many religions, the Jewish faith, the Muslim faith, going all the way through the month of May. We've seen outbreaks in other parts of the country and even in other parts of California because family, social, and religious gatherings did take place. That includes birthdays, funerals, and even church celebrations that didn't follow the shelter-in-place orders. We saw specific outbreaks from people that participated in those, so we do ask, even during this time of religious celebration, to follow it at home, personally or virtually. There's many creative ways to continue practicing and worshiping without putting yourself or your community at risk. Regarding congregate facilities, it's something that we take very seriously. Task Force number 7 out of our Emergency Operations Center is dedicated just to this issue of those elderly facilities where we have seen outbreaks. So we do have a new health officer order coming next week that will guarantee more safety for the staff as well as the residents, require all masking of staff and visitors, and decrease staff working in multiple sites that can spread the virus between different facilities. Some have heard of the Lamorinda Care Facility. We're supporting that with the disease investigation. The state is on site currently, and they're helping with staffing contracts, and we're working closely with regional partners like John Muir Infection Control to decrease the spread there. We are planning for alternative care sites, things as big as the Craneway Pavilion in Richmond, set up with cots ready to go. We are depopulating homeless shelters and other places where there's a lot of density and putting people in hotel rooms to decrease the risk, but also reserving those sites and shelters in case we need backup sites. Our obligation is to plan for it. Hopefully we won't need to use it. Regarding enrollments of social services, we've seen a drastic increase, which is a positive thing for women, infant, and children getting food and nutritional services from Meals on Wheels. It's increased from 17,000 to 35,000 seniors in our county getting food delivery, which is great. And we will continue to accept donations, both for personal protective equipment as well as emergency childcare that we're setting up so our first responders can have childcare. I'm a parent as well, and it's challenging to work and take care of the family, so we appreciate that support. Our call center is active, so if you have any questions, you can call 1-844-729-8410. And I'm going to end by talking about masking and what you can do. You may have heard the recent guidance around masking, and the important thing is that the public doesn't need an N95 mask if you're going to the grocery store. You don't even need a surgical mask. A simple cloth cover will do. A bandana, something reusable. I don't use a plastic water bottle every day. I use a water bottle that I can refill. Same can be true with masks, so we can preserve them. We have a shortage of these essential supplies that we need for first responders and hospital workers that have higher risks, close proximity to those respiratory droplets. But a simple cloth cover can not actually protect you, but protect others. So if you do cough or sneeze, if you don't yet feel those symptoms, but you have the virus, that's what's so tricky about this. That's different than the flu. You can actually have it for a couple days without realizing it and pass it to others. That we do recommend, if you have to go out in public for essential services, to use a cloth face cover. And I'd like to end by telling you the World Health Organization's recommendation for 5. So I want everyone to put their hand up and show 5 fingers right now and repeat after me. Hands, elbow, face, space, home. Hands, elbow, face, space, home. So hands, wash those hands for 20 seconds, all sides. People forget the thumbs, the back, in between, the wrists where you touch doorknobs. Full 20 seconds of hand washing is the best way to prevent it. Gloves won't protect you. You can still touch your face and transmit the virus. So hand washing, old-fashioned public health, is your best prevention technique. Elbow, cough into it, not into your hands so you don't spread it. Face, humans touch their face 20 times per hour. The virus can spread to your mouth, nose, or eyes, even if you're wearing a mask or gloves. So practice not touching your face, hands, elbow, face. Space, 6 feet apart, prevents the virus from being transmitted, whether you're at the grocery store or the pharmacy or the doctor's office. They say, morbidly, if you're not 6 feet apart, you may end up 6 feet under. And that's the reality. And finally, home. Stay at home. When in doubt, don't go out. So hands, elbow, face, space, home. Happy to answer questions. Thank you.
Well, there's a new trick. I didn't know about hands, elbows, face, thumb, but as a mother of young children, I think 20 times an hour touching their faces is an understatement. So we're really working on the hand washing piece. But it's led to some good new habits. But thank you for that incredible update and all that helpful information. And again, I think to your point, the Bay Area has done an incredible job of sheltering in place. And obviously cases are increasing, but at a much slower rate than otherwise would have been true. So we appreciate that guidance. One question we got from a constituent was the status of testing and how available it is today. Do you mind addressing that?
Sure. So testing, as you know, throughout the country, throughout California and our county, has been slower than we would like. But the rapid PCR test that looks for the RNA viral particles of the virus, if you are a sensitive worker or in a sensitive setting, that means a group environment like an elderly facility or a first responder, law enforcement, a doctor or a nurse, we want an answer in 24 hours so you can get back to work and not infect others. We have plenty of capacity to test those people and get an answer within 24 hours. As for if you have a bit of a fever and a cough and you call your healthcare provider and they may recommend a test, the private commercial labs do have plenty of capacity as well. Every health system is a little different in how they're interpreting those Center for Disease Control guidelines, but the turnaround time for those can be up to 5 days. So if you think you may have it, and many people may have it and not get a test, we ask you to play it safe and do isolation and quarantine. I briefly want to distinguish those two things. Isolation is when you actually test positive and you're asked to stay at home for a full 7 days from when you tested positive and an additional 3 days after you stop having symptoms. So that means no fever and you can't take Tylenol or any fever reducer, and improvement in your shortness of breath or cough. That's isolation. If you test positive, Stay at home so you don't infect others. Quarantine is play it safe. We may not have a result for you, but if you have those symptoms or you think you could be sick, better to play it safe and stay home for a full 14 days.
And we got a question from Lita, who asked, do we have a plan to do at-home test kits? Haven't heard about that.
Yeah. Not to my knowledge, but we do have mobile testing capability, again, for those high risk settings. So if there's an outbreak in a particular group facility and we need to get quick answers to provide safe care to minimize spread to workers and lots of people, we can go to a site and put the swabs in people's noses and mouths and then go process them. There are certain tests that are coming out that are not approved by the Federal Drug Administration, the Food and Drug Administration. So be careful, let the buyer beware. There's a lot of things being marketed right now that are not accurate and provide some false negatives as well as false positives. So please only use approved testing methods.
That's good advice. And one thing I want to add that we had, John Muir had reached out to us and asked us to make sure we got the word out about was that if people are having symptoms that require urgent care, something that mirrors a stroke, I know people are afraid about COVID-19, but they're seeing people wait a little bit too long to get that urgent, emergent care. And so we're talking a lot about the treatment and the testing you need for COVID-19, but if you're having symptoms of something else that is urgent, your doctor really wants you to call and go get treated for those things. Don't wait too long. And I'm sure that the health department would agree.
Yeah, thank you for that reminder. Part of the flattening the curve and preserving the capacity is to take care of all the other things that we get sick and ill with. We don't want routine care to be delayed because we're overwhelmed with taking care of coronavirus. So please contact your health providers or 911 if you do have an emergency. We do have the capacity to care for you. We've been planning for this for weeks and we're ready and there to support you. And also don't go in if you don't need to. You can call and get a lot of things dealt with virtually, but do go in if it is a true emergency. All of our hospitals and emergency rooms are safe. We follow close infection control procedures. We have private rooms to isolate people. So you are not at additional risk if you're going in for a different healthcare issue.
And so one follow-up question we got from John about something you talked about is, can you clarify the difference between household quarantine and isolation? What he understands is that not only people suspected with infections, but also the people they may live with should isolate. So if I were to be suspected and my husband, should he also isolate? Should everyone in the house isolate?
So what happened last week was actually blanket universal health officer order that people may not have been familiar with. And you can see the wording of it in English and Spanish on our website, cchealth.org. But what that means is we're no longer just suggesting or guiding that if you are positive or if you live with someone who is positive for coronavirus COVID-19, that you stay at home. It's now actually a legal requirement with fine, citation, and it's a misdemeanor if you don't obey those guidances. That's how seriously we're taking this. So to answer that question, yes, if you live with somebody who tests positive, you are at very high risk as well, and you should play it safe. And that guidance is on our website. That would be considered a quarantine because you haven't been tested and you may not need a test, but you're going to be asked to play it safe and stay at home for 14 days from the time that your close household contact tested positive and decreased their symptoms. It can be a little confusing, so all of that guidance is on our website.
Thank you. And then one follow-up question from Lita. So she wants to know about that antibody testing you were talking about. How will that be available to people and in what setting? Will it be an at-home test? Will they go to their doctor? Will it be drive-through? Do you have information about that? You said a couple weeks, which is very exciting.
Yeah, to be determined. It won't be a drive-through. It won't be a rapid test. It will likely mean puncturing the vein, venipuncture. It won't be a simple swab because we need to look at your white blood cells, your antibodies that prove that you've seen the enemy and you've developed your own soldiers to fight it. Those are those immunoglobulins. And so it has to be a blood test that's done through your arm. So it would be done at a healthcare facility or at a lab. Again, there's a lot of unproven antibody tests that are being circulated right now. So we're waiting for true Food and Drug Administration approval that may come in a couple weeks. But that rapid PCR testing is available right now from your healthcare providers if you qualify and if you do have symptoms.
Got it. Thank you for that clarification. And thank you for all that information. And I know you'll be on the line in case we get more questions, because people have a lot of questions for you. So I appreciate everything you do to keep us safe, and it is working, and that's such good news. So next, we're going to turn it over to the City of Lafayette. We're going to talk to Jay Lifson, but first, I want you to know we don't have a City Council member or City staff here because they had a City Council meeting right now. But my field representative from the Lamorinda area, Katie Keeshan, is going to give an update from the City of Lafayette and how they're responding to COVID-19 before we turn it over to Jay from the Chamber. Katie, take it away.
Hi, everyone. So this was sent over to me by the City of Lafayette, and they have some things that they just want to make sure everyone knows about. So they're continuing to conduct public meetings. They're doing so virtually. Meetings are announced on the city's website, and the public is able to watch the meetings on the City of Lafayette's YouTube channel. They're taking public comment by email. That email is cityhall@lovelafayette.org. They're asking the public comment to come in no later than noon on the day of the meeting, or you can make a comment on an agenda item during the meeting. You're just sending an email to that same email address, and your comment will be read into record by the staff. They're working the best they can to conduct business during this public health crisis. So they're working hard, and they appreciate your patience. Their staff are continuing to work virtually weekdays 8 a.m. to 5 p.m. and they're monitoring telephone, email, and social media. They have COVID-19 updates from Jeff Hyman, the city's communication analyst. You can sign up for those on the city's website as well. The city's offices are closed to the public, but the planning and building department and the engineering department are both doing virtual office hours and a virtual counter for you to be able to ask your questions and talk with someone from the city. You can again find more information about that on the city's website, and they have COVID-19 specific FAQs for both of those. There's something that Narup, who's the city manager for the City of Lafayette, wanted to make sure we mentioned. So city just announced a business and nonprofits assistance program. So there's money and loans available for small businesses, and there's been a lot of talk about how to apply for those and workshops. The city has hired Townsend Public Affairs to help Lafayette businesses and nonprofits navigate the loan process. They're really excited about this program, and if you are a Lafayette business or nonprofit, you should reach out to the city. They're kicking off this program next week, and you can find, again, more information on their website. So that's the update from the City of Lafayette.
Awesome. Thank you, Katie. And that program from Townsend Public Affairs, which I don't know if Jay is going to touch on, is a really exciting one, because I know the SBA loans have been a challenge for people. So to have some assistance from that city service is pretty phenomenal. So with that, let's turn it over to Jay Lifson. I know that you are working really hard to support our local businesses while we're sheltering in place, and I know how challenging this has been for them. Do you have any insights for us on how to support them, and give us an update on what's going on in our area? Oh, Jay, your sound isn't working. Oh, okay, wait, he's gonna hold something up. He says, I'd love to report out, but I'm having audio issues. We must have done 2 dozen Zoom meetings last week, and it's first time having a problem. Okay, well, Jay, you probably can't see him because he's silent, but if you need help, I know the Lafayette Chamber is there to help you, so reach out to them or reach out to my office and we can connect you, because they are there supporting our small businesses, and they do need our support to the extent that we can do so. I know that my husband just got back from our weekly trip to Diablo Foods to try to support our local market. So, continue to support small businesses if you can. And now I'm going to turn it over to Mayor G. Mayor, thank you so much for joining us and sharing some information about Orinda and what we're doing here to support the city. You want to tell us what's going on the city level to address COVID-19?
Absolutely, Rebecca. Thank you for having this, and thank you for inviting me. Many of our updates are very similar to what Katie just announced for the City of Lafayette. We are still, to the extent possible, open for business. We held our first Zoom City Council meeting this past Tuesday night, and we have 2 more City Council meetings upcoming this month that the public can participate in. One is on April 15th, and one is on April 21st. So all of that information is available on our website. Much like everyone else in the county, we've complied with all of the county health orders to the extent possible. So all of our city facilities are physically closed, but the city remains open for business. Our staff, to the extent possible, is working remotely. We're working very hard to respond to telephone calls, emails, and I think we're finding that everybody is connecting with the city and getting good service if they need it. Our planning department is still open remotely. They're still able to conduct business, and they've had some very good virtual interface meetings to keep things moving along for the future. We've worked very closely with the school districts because we have a lot of school property in Orinda, and we work very closely with them to have signage, to close off facilities that need to be closed off, and to continue that communication. We are extremely proud of our volunteer efforts that's going on in Orinda. Many people that live here are very familiar with the Orinda Association and many of our other wonderful volunteer organizations. We've done a great job of matching seniors that need support for groceries and pharmacy deliveries with our volunteers, and have worked with our senior living facilities to connect them with that service as well. So I understand that's working out very well, and that's available to anybody in Orinda. If you need help with that, reach out either to the city or to the seniors around town on the Orinda Association website. We're very proud of everything they're doing. We're working hard to support our local small businesses. We are definitely urging everyone to use the takeout restaurant options. We've helped our small businesses and restaurants that don't ordinarily do deliveries. We've helped them with the technology to make sure that they can get on the platforms to be able to do that, to maintain their businesses. We're working with them very closely. Some of them have been very concerned about rent issues and, not being worried about being evicted since they have no revenue coming in. We're working very closely with them to help make sure that we allay those fears and that we help in every way that we can. We want them to all be here when everyone can go back together. We did reach out as the city to the Orinda Care Center, as the doctor mentioned, but there appears to be really nothing else that the city can do directly that would be a help at this time. But if there is, we're certainly prepared to help with that. Many of our residents wanted to offer up anything that could be done to help, and so we'll stay tuned for that. But I think the best thing for us to do is let the county and the state handle that very effectively. We continue all of our city communications, and we urge people to sign up for our Outlook newsletter, our Nixle alerts, our postings on Nextdoor. We want to make sure everybody can receive all the information that we are putting out, and there's a lot of exciting new things. We're looking at some virtual recreation since we can't do the physical recreation right now. So that was posted today. So parents in Orinda might be very interested in that, since I'm sure it's getting day by day harder and harder to keep the kids with things to do that are productive. I think that's everything I had on the list. I think that's everything I had on the list. We're continuing to urge our residents to comply and do everything that they can to protect everyone's health and safety. And we're happy and to be responsive and take any questions that anyone may have.
Thank you, Mayor. And I know there's some this community really has come together in such incredible ways. I signed up for Seniors Around Town for my family to be paired with a senior, and there's a lot of ways that we can help, and we are, and that's awesome. So thank you for everything you guys are doing to keep us safe. And remind people that although being outside is important, playgrounds aren't the safest place for you to be right now, and so shutting those down is really key. So thank you for that. And I will now turn it over to Chief King from the town of Moraga, whose Nixle alerts I always really appreciate. So thank you, Chief, for all you're doing to keep our community safe during this time and always. Can you share an update from the town of Moraga?
I sure can. First of all, I want to thank both you and the senator. We get regular inquiries from you, both of you and your staffs, about how we're doing, if we need anything, and the level of support that the two of you and your staffs provide us are fantastic. I just want to say thank you.
Thank you.
You know, we're doing our very best to coordinate with the health department. when before the call started, I was finally able to put a face to the voice with the doctor, because we're on conference calls a couple of times a week together, but all I'd done is heard his voice, never seen him. So it was kind of a neat gift for me to get to see him. And I will tell you, when this started, I was one of the naysayers thinking, oh, this is just another flu bug. But one of my daughters is a nurse in New Orleans, and she's an ICU nurse at the Tulane University Medical Center. And I got a phone call from her when this first started telling me, Daddy, I have never treated people who are so sick. And so when we hear how serious this is, it really is. And she's a fairly new nurse, but her descriptions of how sick people have become from this virus, it scared the daylights out of my wife and me. And so I share that just from the standpoint that this is very serious, and how we talk about social distancing being difficult, but having some difficulties over a month or two is nothing compared to what we could face if we were to catch this thing. I was talking with somebody, or I overheard a conversation in Moraga the other day about somebody, and I kind of paraphrased it on one of the Nixle bulletins. Somebody says, oh, well, we're just going to have dinner with neighbors. So, it's no big deal. They're just our neighbors. And as I put it, well, this now connects you with the infected friend of your neighbor's son's girlfriend's mother. And when we talk about breaking the chain, that's what it is, and flattening the curve. And people don't understand, it's not just dinner with your neighbors. So as far as what we're doing, we're coordinating with all of the agencies in town, our Chamber of Commerce, Lamorinda Fire Department, the school districts, everything we can do to help people and educate them about the health officer's orders. And one of the things is, if people do have questions about it, we try our best to answer them. But the phone number that Dr. Rohan gave us earlier, the health department folks on the other end of that line are fantastic about answering questions. People have questions like, gee, does this order apply to me? Can my business be open? They're very good at answering those questions and kind of cutting through the chaff to get to the wheat. And so it's an incredible resource. Our city offices are closed like everybody else's. Our staff is working virtually. We do have some essential staff in the building. Obviously, my team is still working, and we're using all of the personal protective equipment we can, because we need to keep our officers and our firefighters safe so we can respond to help other people. Our council meetings have also gone to remote and Zoom. They're viewable on our website through our live stream, and also on CCTV, which I think is channel 26 if you have Comcast. Our parks, we caught a lot of grief, I guess I'll say, from some people, because we closed the skate park and we've closed what we consider to be the dog park at Rancho Laguna. But that is pursuant to the health officer's orders, and again, for really, really good reasons. And then we're trying to do our best to educate people about the incredible businesses that we do have in Moraga. And we have fantastic restaurants and other businesses that are open, and encourage people to use those businesses whenever possible. And I think I can speak from the other two police chiefs too, in that when the officers we're getting a lot of complaints from people about others who are violating the order. And so we do go out, we make contact, and we're trying to do it on an educational basis. The last thing we really want to do is take strict enforcement action, because everybody's already stressed out enough. We don't need to add to that burden. And so what we're trying to do is do everything on an educational level, not to say that we won't get to a strict enforcement level in the future, but if we can keep it where it is, that's what we want to do.
Awesome. Thank you, Chief King. And how should folks get in touch with you if it's not an emergency?
Absolutely. So we have all of our numbers are active. It may roll to voicemail. So we can, but staff will get back to people as soon as possible. Obviously for all of the public safety agencies, our numbers are staffed, and we actually have staff in the police department all the time, and then through our dispatch number 925-284-5010, which works not only for Moraga Police but also Orinda and Lafayette. because we're all dispatched by the Sheriff's Department Dispatch Center. So
Okay.
it makes it very, we want to make it as convenient as possible for people. So
That's great. And thank you for being out there. I know that every day that you show up, you're at risk of getting this virus, and we so appreciate you continuing to do your job because it's so critical. And all officers. And now we're going to turn it over to Lynn Mackey, our County Superintendent of Schools. Thank you so much for joining us and for all you've done to keep our students and our community safe. I know that not all parents were super happy when you closed the schools, parents for elementary school kids, but it was obviously the right decision from a health perspective, and you're listening to the public health experts, and making those hard decisions was really commendable, because we, again, have seen the fruits of the labor. So this week, Contra Costa and the 5 area counties announced that distance learning will go through the end of the school year. You want to share some information about this decision?
Sure. Thank you, Rebecca, and thank you to the Senator for having these forums and getting this good information out there. And I really want to thank you for having Dr. Rohan on the call. We're on many calls together. Him and his team really have been in true partnership with the school districts as we've been making our decisions. And first, I want to recognize the extraordinary work that our county Contra Costa school districts have been doing in their communities. I really believe that the superintendents and the other school leaders in our communities have been doing heroic work in this efforts to try to move really our, hundreds of years of a school system into this new way of learning under great duress in such a short period of time. And as the world has changed, we've had to change with it, and quickly, and it's been under pressure. And I think they have handled it beautifully, and I just commend them for their work, all the educators, all the teachers. The facts are that, things are changing drastically, and in that spirit, we're trying to keep the students safe. So the decision to close schools to the end of the year was truly based on a public health issue, because we have to keep in mind, first and foremost, this is a public health crisis. And everything that we do socially and through schools needs to fall in line with what are we going to do to keep our community safe and our schools safe. So some things that the school districts are doing, we have to, we don't only have to take care of the students educationally, there are a lot of social issues that need to be taken care of. So we are feeding students. You can go onto any of the school districts' websites or our own website and see where the food distribution is happening in the community. We're working to protect the mental health of the students. You can also go onto their websites and see how they're providing mental health support. I think one of the greatest resources that have come out just recently was California Surgeon General put out the Nadine Burke-Harris. It's a guidebook on stress relief for caregivers and kids. It's a wonderful, wonderful resource about working, being at home with your children, how to relieve their stress, because one of the most important things we can be focusing on is their well-being, even above and beyond their academic success at this time, and really focusing on what is developmentally appropriate when it involves school. So there's a different plan for a high school senior who might be doing well and has all his social areas taken care of. That might look different than somebody whose family has become unemployed and maybe doesn't have a roof over their head. And what does that educational plan look like for that student? Or what does the plan look like for a preschooler or kindergartner who is learning how to read, right? And what type of support do we need to provide families so that they continue to do the work so that those students develop academically without stressing everybody out? It really is a real fine balance. And we really are trying to encourage everybody to create some type of normalcy for the students, have a schedule, not overscheduled. They don't need to be doing school all day long, but have a schedule so they're getting up, getting dressed, doing some schoolwork, getting exercise, following the protocols for staying well, making sure they're getting exercise, eating right. I think there's the 5 when it comes to taking care of yourself. We have had to make some really hard decisions, and I know that all of those decisions haven't been well received. And I had as many calls to keep schools open as I had to close schools, you know, it was, and as many emails, a lot of emails with people, just their fears. They had fears about keeping schools open and they had fears about keeping schools closed. And it's just really important for us as in the education community to fall in line with public health and follow the direction of our public health officers. We had a lot of debate on the grading issues. There's been a lot of really robust debate, and there's been a lot of good guidance out from the state and other resources about equity in grading. Again, you know, we have some families that can sit side by side with their students and do their work. And then we have some families that are worried about, they don't want their student online, why they aren't there to be able to monitor them. They are having to work, you know, they might be healthcare providers. There's just so many different scenarios as there are students in our county. And we want a grading policy to be equitable. And we're very grateful that the UC system and the university systems are acknowledging that and really are just waiving grades for this time, so people don't have to worry about that. Though I do know we have some very high achievers that are used to, you know, going for that good grade, and I think they just need to adjust their thinking just a little bit, and just it really should be about, you know, gaining knowledge and checking for understanding without feeling the pressure for going for the good grade. So I do think we have been doing heroic work, our superintendents and our educators, and I won't be able to talk about each individual plan, but every school district has a website where they have their individual plans, and then you can also find, we have them all on our website also. So
thank you. And I know, you know, I'm doing distance learning with my 3 kids, and a little different with the kindergartner than the 4th grader.
yes.
But, you know, your point about teachers being heroic right now is well taken, because I mean, the work that has gone into preparing for this distance learning for kids as young as 5 years old who don't know how to move a mouse correctly is phenomenal. It has really been quite the feat, and it's not easy. I'm there with all the parents on this call feeling like it's horribly hard. But, you know, we are doing the best in a very difficult situation. And at the end of the day, like you said, the health of our children is paramount. And so
Yes.
I respect the choice, and thank you for making a choice to keep them healthy and safe. We got one question from Lindsay. Do you know if schools have thought about what to do about promotions and graduations and celebrations? Is there a thought about whether those might happen down the line?
Yes, so I know that each school district is thinking of ways of honoring those students, and I know they will do something that will be fun and exciting. It might be remote. I do know that the districts, especially in the Lamorinda area, are talking about getting parent feedback. This is the time of year that we would normally be getting parent feedback for our LCAPs. So I know that they're planning on checking in with parents and doing some type of virtual check-in to see how is it going. Get feedback from the parents to see what they might like in that area. But that is on the front of everybody's mind, especially around high school graduations and ways of bringing people back in the future to really celebrate and acknowledge their accomplishments and achievements.
Yeah, thank you. And we'll link to that resource from the California Surgeon General. It sounds like it's something I need to read, so I appreciate you pointing that out to all of our listeners. And then, so now I want to give you a little bit of a state update on what we're doing to help constituents. And I know Senator Glazer, I'm pointing like you can all see the grid in front of me. This is how you start to feel like these Zooms, we're all together in a room. And Senator Glazer also has an update, so we'll provide those now. So as you know, and as you heard from Chanel Scales-Preston, the federal government passed a relief package that is in part coming your way. So for those that make less than $75,000 for an individual or $150,000 for a family or a couple, you will be receiving a check, and that should come in the next 4 weeks. So if you don't receive that, please do reach out to the congressman's office or to our office to make sure you get those resources that are coming your way and should be coming your way. For mortgages and renters, there's been relief, and it's really important that you know about this. There's information on my website about this, but one of the most important things I want you to know is that that mortgage relief is not automatic. some of the communications that came out were interpreted that way, and it's not the case. You do need to reach out to your mortgage lender and have a conversation with them about how to get that mortgage relief. And many lenders are giving relief so that you don't have to pay it now, but you do have to be in communication with your lender in order to get that relief. The other thing is, again, renters, look into what is available to you. That is county by county. But utilities and electric companies have assured us that they will not turn your utilities off. That is really important for people to know. One of the things that we just heard from Lynn Mackey about is the stress that people are feeling. And one of the stresses is coming from, how am I going to pay for my water and my electricity if I don't have a paycheck? And you should know that your electricity and your water is not going to be shut off during this time. We understand what you're going through, and we worked to make sure that's not going to happen. Tax deadlines is something that's come up a lot lately. Property taxes are still due, but we want you to know that the county assessor's office is able to give you relief if you need it. So the due date is what it is, but they will waive penalties and fines if you need it. So reach out to our office, to Senator Glaser's office, to the county assessor's office if you need some relief on your property tax, because it is available to you. But again, you do need to go through a step to get it. So, and we can support you in figuring that out. The federal tax deadline and the state tax line are now July 15th. You can file anytime before then if you'd like, but the deadline is moved to July 15th. Also the DMV. One of the calls we've been getting a lot are from seniors and vulnerable communities whose licenses are coming due and they don't want to go to the DMV and stand in line. You are making the right choice. And I see that the doctor is shaking his head not to go to the DMV and wait in line. And as a result, the DMV has waived ticketing for expired license for 120 days. So you do not need to worry about going to the DMV to renew your license if you can't do it online. You need a test or something. We will not be enforcing that for 120 days, so you do not have to go wait in line and be exposed to people in the DMV. And we expect that if things change with the shelter-in-place order, that timeline will change. So I want to encourage you to check out my website. There are exhaustive lists of resources there, and reach out if you have questions. We are here to support you. We are answering the phones. We are available through this time, as we know more and more questions are arising for people day in and day out. So thank you so much for being engaged and getting these answers, sharing them with your friends and family. I now want to turn it over to Senator Glaser to give a little bit of a hello and an update.
Thank you, Assemblywoman, and thank you for your great leadership, bringing community leaders together, sharing factual information. It's really the thing that you're trying to do, and I'm trying to do the same thing on. It's a difficult time, and nobody could have ever imagined. I mean, I think back a month ago, 2 months ago, the start of the year, and how our plans have been completely turned upside down. And I appreciate how much stress it puts all of us under, everybody who's watching or listening, your own family circumstance. Certainly for those who have businesses that have had to close, people who have lost their jobs, just the stresses and strains of having your kids at home and trying to do this, the learning, requirements that they're so important. So it's just a difficult time. We are trying to do our best to facilitate all the issues and concerns that you have, as the Assemblywoman has done a good job of reviewing. If you're a small business, there are real opportunities out there for grants and loans. You've got to check that out. Let us know how we can help with that. If you're one of the 2.4 million Californians who have filed for unemployment insurance in the last 3 weeks, there are a lot of great programs. In the past, if you were self-employed, you weren't eligible. The new federal program allows you to have eligibility and can provide substantial resources, over $2,400 a month for the next 4 months. If you're having trouble working through those issues, then our offices can help you. And both federal aid programs for business and for individuals have gotten off to very slow starts. So there's a lot of bumps and slowdowns there that are very frustrating, especially when you're under stress. So again, that's a place where the Assemblywoman's office or mine can help you. I have done the same thing that she has done on my website, as a lot of these resources to help you maneuver through these things. And we've had 10 telephone town halls about pets, about coping skills, about the supply chain for our grocery stores and pharmacies, and a lot of the things that you may be thinking about and worrying about. There's resources on my website as well as the Assemblywoman's website to help you. And so maybe just in closing, just say, we are one big family here in Lamorinda. It's a great community to live in, to work in, and to play in. It's it's a darker moment in our life, in our community's life, but we are going to get through it. I think that there is a lot of positive news out there about how we're bending this curve and hopefully flattening this curve so our lives can get back to a new sense of normalcy, although it'll be a different sense than it has been in the past. So I'd only underscore what the doctor has said about physical distancing, staying at home, being safe. I know there's the spring fever as the weather gets better. People want to go out and they say, why can't we get together with another family? And there's just a lot of reasons to say absolutely not. This is not the time to break our shelter in place commitment because that is going to get us out of this so much faster if we can just hang in there and do what's necessary. What's happening here in the Bay Area has been driven by public health. It's our physicians, it's our public health directors saying this is what we need to do to survive, to protect all of us, not just the elderly. Half the people that have been admitted to hospitals are under the age of 50. The mortality rate is incredibly higher the older you are, but we have to protect and help each other. And that means listening to our public health experts that we've heard from today and really continuing to do our part as hard as it is. And with that, Assemblywoman, thank you for having me on.
Thank you so much, Senator. Dr. Rohan, I got a couple questions that I'd like to try to sneak in before we run out of time for you. One question was, do Orinda residents need to have concerns about exposure from the Orinda Care Facility and the outbreak there?
So the answer is no. One particular facility doesn't put entire city at risk. We don't want you to have a false sense of fear because there may be an outbreak at a particular facility wherever you live. We also don't want you to have a false sense of security or reassurance because there isn't an outbreak or a lot of cases posted on our website based on where you live. So we're taking infection control seriously. People move between cities. Initially, when we didn't report the number of cases by cities, people were very upset. And I told them, well, what if you live in one city, work in another, shopped at a grocery store and may have contracted it in another and are actually under isolation at a family member's house where you can get good care? Which of these 5 cities are we going to report? So it is everywhere and you're not at particular risk based on where you live. But there are those preventative things you can do to protect yourself.
Thank you. And I actually have to appreciate you for your new dashboard. As a numbers nerd, I really appreciate it. And for those of you that haven't checked it out, it's on the Contra Costa Department of Public Health website, and it does give you those city-by-city numbers, the number of hospitalizations, the number of cases, and you can really see that curve and the trends that are looking very positive. So I appreciate that. Thank you. And one of the other questions we had for you is, how safe is it to get takeout? We've talked a little bit about supporting our small businesses. Some of that involves getting takeout, getting a break from cooking for those of us who can afford to do so. Is it safe?
It's very safe to get takeout. People are focusing on the wrong things, and there's a lot of misinformation out on social media. I was on the Rossmore TV station 3 times in the past couple months answering these questions of, should I put my mail in the freezer? Should I reheat my food if I'm ordering takeout? And the answer is no. Those 5 common sense things I said are your best protection. Hands, elbow, face, space, and home. Wash your hands, cough into your elbow, don't touch your face, space, maintain the 6 feet, and stay at home. Beyond that, you can get mail, you can order takeout. Wash your hands frequently when dealing with outside things, but that's all that you need to do.
Great, thank you for that. And then I think we have a new feature right now. We have Katie on with a live question. Katie? This is gonna work.
Can you hear me?
We can. Go
Oh,
for it.
good. Hi, everybody. This is wonderful. Thank you for doing this, Rebecca. My question is, how can community members help? We'd like to be as helpful as possible, and I don't think we always know what the needs are. And I'll take Lamorinda, for example.
Mm-hmm. Well, I know that Mayor G had to run for a 3 o'clock meeting. She had mentioned seniors around town. I know Lamorinda Village in Lafayette is helping support seniors. And just, I mean, I'm going to ask the chief to jump in here too, but, you know, check on your neighbors. I mean, I think that's one of the most critical ways for us to take care of each other these days, is really looking as close to home as possible and making sure that people around us have what they need. And for those with special skills, I know there are people out there sewing masks, and our VA hospital is accepting those hand-sewn masks. So, there are different ways to help. The county, I think Dr. Rohan mentioned, the county is accepting donations of PPE. So there are lots of different ways to help. I know there's more information on our website, but Chief King or Dr. Rohan, do you want to mention any ways people can help?
Yeah, Katie, one of the things that we've talked about is just like we tell people when when potentially we have to evacuate for a wildland fire or something like that, we'd say, go to your neighbor on the left, knock on the door, go to your neighbor on the right, knock on the door. Well, this way we're saying kind of the same thing, except stay 6 feet apart, away from your neighbor, but check in on your neighbors and see if they do need help. Check in with the local service clubs in all of the cities, because they're all organizing different things to support different people in the membership in the community, and also our churches and other community groups are doing the same thing. So first off and foremost, check on your neighbors and make sure they're okay, and then branch out from there. And if everybody does that, first of all, we probably, I know in my neighborhood, I live in Clayton, we at the end of a court, and all of us are constantly texting each other and checking in, and my wife made care packages for all of our neighbors and went and dropped them off, and just those types of things will really make a difference.
Yeah, Dr. Rohan, any tips?
Yeah, this is really, as Senator Glazer mentioned, an unprecedented time, a once-in-a-century challenge, but it's also a once-in-a-century opportunity to come together, to love thy neighbor, be it virtually, be it from 6 feet apart. I issue orders with my medical license on what we cannot do, but I want to spend just as much time talking about what we can do, not just on the personal prevention and hygiene, but also on the promotion of love and togetherness and neighborliness. So just because you're physically distanced doesn't mean you have to be socially isolated. There's a lot of ways to reach out to those who may be more vulnerable. Maybe they don't have the technology skills. Maybe they don't speak English. Maybe they come from different backgrounds, and you can let them know about some of these programs that are on websites. You can help them interpret the resources that are out there for small businesses. You can keep people's spirits up. Our prior federal Surgeon General said that loneliness is a public health epidemic. And we're seeing more of that now as people are afraid, there's more anxiety, there's more paranoia, there's a lot of stigma that comes with pandemics. And so you can do a lot by loving your neighbor and reaching out to people. I also want to speak about the healing power of nature. You can't go to a dog park, you can't play on a playground, but you can walk outside. You can encourage others to do the same. You can help people overcome their anxieties and fear right now. This is not all going to end on May 3rd, and there's a lot of ways we can support our neighbors.
I love that. The doctors ordered us all to love thy neighbor. It's the best doctor order I got all day. Take it. Thank you for that question.
Thanks very much, everybody.
So that is all the time we have today. We even went a little over because I had to get those important questions in for the community, but I want to thank you all for joining us. We'll be hosting more telephone town halls in the future, both me and Senator Glazer. So keep an eye out for those emails and notifications. You can go to either of our websites or call our offices to get support. There's important information there about education, groceries, and more, small business relief, unemployment insurance, all the things that the government is here to support you on. So I want to thank all our participants for joining us and providing this incredible information directly to our constituents. The good information is the antidote to so many things. So thank you for providing it, and for all of your hard work during this time. You know, we can tell you're hard at work keeping our community safe, and I'm so grateful for that. And I want to thank all of you for staying informed and for practicing social distancing, for attending virtual town halls. That's one way to social distance. And it really is making a huge difference. So keep it up. I know it's long. I know it can be tiresome, but as the chief mentioned, it is better than the alternative, and that is without a question. So together our community will get through this, and it will be through the work of each and every one of us. So it has been a pleasure to serve you through this time and to see our community come together. And I just want you to know that we continue to be here for you. Go out there, check on your neighbors, be safe, stay healthy, and reach out for any resources that are needed, because we are always here for you. Thank you for coming.
Thank you.